Welcome back. This is Rohrich Knose, episode 14. We are going to talk today to a world famous dermatologist who's been a close friend of mine for years. And we're going to talk about how plastic surgeons and dermatologists can work together and actually do so to actually help you be your best self, both, from your skin and also in the aging process. So, Mary, welcome to Rohrich Knose. And Mary is an amazing board certified dermatologist, and she's at New Orleans. So, Mary, tell us a little bit about yourself, where you grew up, and how you ended up in New Orleans.
Well, I ended up because that's where I was born. I was born here and raised here, and got a great undergraduate scholarship to Tulane and stayed, and then went to medical school. So I am born and bred and continue to thrive in New Orleans. New Orleans is a very unique place, and you either love it, or you don't. And once you get used to New Orleans, it's very hard to duplicate.
Oh, I agree.
New Orleans anywhere.
So what drove you to what made you become a dermatologist? I mean, she's a brilliant physician. So what drove you to dermatology?
That's a very good question, because a lot of young people interested in medicine will ask me that same question. And I really remember very distinctly, I was 16 years old and I had this really disgusting thing on my lip. And my mother took me to a dermatologist, and right on the spot, he fixed it.
What was it? Was it a zit or what?
It was just some sort of zit. I don't know.
Well, that's great. And that changed. That's amazing. I never heard that story. And I've known you for a long time.
And I was always very, very good in science.
Yep.
And very good interacting with people.
Yep.
And I just wanted to be sort of my own boss too. I didn't want to work for anybody. So it just seemed like my skill set, my talent, and my personality just led me to want to apply to medical school. And then I went to medical school, and I absolutely loved medical school. I never felt like it was too much work, because I really felt for the first time in my life that I was learning something that was really relevant and useful. I feel like everything I learned up until then were interesting academic discussions and learning to learn, if you will.
Right.
But, in medical school, from the very first day, you really learn things that are useful.
Yeah.
And I loved pharmacology, and I loved physiology, and I loved neuroanatomy and neurology. Wow. And I think everyone who goes through medical school, I actually went to medical school thinking I wanted to be a dermatologist. And because
did you tell people that? Wow, that's
yeah. So then once you get into medical school, there's so many things that grab your interest.
I know.
You'll deliver babies, and you think that's really cool. And you learn neurology and how the brain works. That's really cool. And then I think about the reality of what that profession would be. And I just ended up by going back to dermatology.
Yeah.
And when I was a resident, that was in 1983 that Zyderm and Zyplast got FDA approved.
Now tell the audience what that is. That's really the first collagen filler.
The very first FDA approved dermal filler.
Yeah, collagen.
And it was like a switch went off in my head, and I went, wow, I really like the concept of making people look better. Right. I remember how I felt better when I got rid of the nasty thing. But, there are other nasty things like wrinkles and brown spots and all these other things. So that was my motivation. Yeah. And I started a resident clinic where I used to get the women from my health club to come and let me practice how to do injections, how to do sclerotherapy.
And that was at Tulane, right? Yeah.
What's that?
Was that Tulane?
At Tulane?
Yeah, no, I know. It's a phenomenal place. Well, Mary, I just wanted everybody to kind of get familiar. And of course, Mary is I have to laugh internally when she says she wants to be her own boss. She's always the boss. We do a meeting together every year, and it's been fun. Cosmetic boot camp. It's like, really, it's really probably one of the best educational meetings of the year for me, because it's where we get together, plastic surgeons, dermatologists, facial plastic surgeons, and oculoplastic surgeons. We really teach cosmetic, the best of the best in cosmetic medicine to the core specialists. And I think that's what's so great. And Mary really started that meeting with two of our colleagues, and it's phenomenal. But so Mary, let's get down to one of the reasons. I mean, I always enjoy working with you and talking to you. So tell me, what do you do as a dermatologist that really that you would say helps your patients the most? You obviously were drawn to cosmetic medicine, and you are a cosmetic dermatology expert. So what is the one thing that you do that I think is the differentiator that makes you who you are?
Well, before I answer that question, I have to say that you helped us make Cosmetic Bootcamp what it is today when you joined forces with us and started your anatomy course. So I have to give you a shout out and thank you.
Well, thanks.
You brought it to another level by your participation. And you know very well that I nagged you until you agreed to do this. Okay. So that said, no, I think the thing that I've always felt that I'm very, very good at is really doing what I call a full facial analysis. And a lot of people will come and see me and they'll have a specific concern. Mm-hmm. Sometimes their concern is absolutely the most important thing that needs to be corrected, but often people get hyper focused on one thing, like maybe it's that one line, or the smile lines, the parentheses, or maybe it's the 11s and the frown lines. And the part of that is because marketing by drug companies tells them what they need to be concerned about, because that's what they advertise.
And yet that's really not what they should look at. Yeah.
Exactly. But often when you really look at the patient and you give them the mirror and you can show them that when you walk into a room, and let's talk specifically about women, because they are like 85% of our patients.
Oh, yeah, or more.
See a line. What you see is the position of the brows, how the mouth is downturned or upturned.
Yeah.
You see shadows, you see convexities and light reflection. And within a split second, a blink of an eye, you judge whether this is an attractive person
or not.
A person who looks tired or angry or sad because of the position of their brows. So what I really try to do is walk my patients through what I see and help them see it, and then talk to them about how I would address each concern. Yeah. And then I prioritize. If you're renovating a house, you can't necessarily renovate the entire house, but you pick and choose, the most important room in your lifestyle. So if you're
so a patient comes to you. So what do you think are the most important things when somebody, and I like that analogy, because I tell my patients, obviously from a surgical viewpoint, there's a lot of the similar things. They come to me for their nose or their face, and I'll tell you what I do. But so when somebody comes in and they say, I just don't like my lips, and it's obviously not that. So what do you tell a patient? And this is obviously going to thousands of consumers about, really, we're trying to educate them to be a better self. So what should the patient say or do when they come to an expert like you, Mary, and they say, hey, I don't like my lips. And then you say, hey, you know what? It's your eyes. Or tell me what you do. I mean, because, you obviously want to put the patient at ease. You don't want to say, man, your eyes don't look good. I mean, how do you do that?
No, that is the most difficult part of what we do, because we have to be in synergy with our patients.
Right.
And we have to be mindful of what concerns them and address that. But we also need to give them the mirror and explain to them what we see, because a lot of times they don't see that the reason that their eyebrows look so sad is because they have temporal atrophy.
Right. That's this hollowing that we hear in the sides of the face.
And their lips, the lips maybe are a good size, but maybe the corners are very downward.
It makes them sad.
Because they've got volume loss.
Yeah.
So you take your time and you explain it to patients.
Okay.
And I always try to focus on what are their best features. And for most women, it's either their eyes or their mouth.
That's right.
And are blessed with multiple good features.
Yeah.
But everyone has some good feature. You know, our good friend Ava Shamban calls it the signature feature.
Right.
The bottom line is what is that distinctive thing about you?
Right. And that's what you tell them. So they come in and you say, wow, your eyes really look great. Let's see if we can make them even better. And you're right.
Exactly. You said it.
Yeah.
You take their best feature
and you make it better.
An exclamation point.
Right.
So if they have pretty eyes, you
Yep.
make sure that their eyebrows are flared nicely, that they don't come down too much here or slope too much here or go up too much here. You really try to arc the eyebrows to a feminine position.
Okay.
Calls attention to their eyes if their eyes are their best feature.
Yeah. No, I agree.
You can have crow's feet and still have gorgeous eyes.
Yeah.
What really ages you is the shadows you can get in the temple, under the eye, in the nasojugal fold, you know, the shadows of the nasolabial fold.
Right.
But a lot of times the nasolabial fold is really caused by that lateral fat pad atrophy.
Right.
Lose that fat pad laterally, and it makes everything pivot and get ptotic or droopy toward the mouth and the nose and causes a nasolabial fold. If you fill that nasolabial fold and don't address the lateral fill when necessary, that's when you get that monkey roll, that
right. But and I think our job is really to educate people. Right. Yeah. No, I think our goal is to educate them, because a lot of times they come in, they just say, hey, I just need a filler. I need Botox or generic. But I mean, I think our goal is to educate them. And I'm like you. I tell them, okay, this really would look good on you. You know, some Botox around the crow's feet, maybe some fillers, you know, around your eye or even in your cheeks. That will look good, because when you look at somebody, you're right, you look at their eyes, their lips, their nose, and all of it is their composite, and everybody has their signature best part. And some people, many actually women will know that. They'll say, my eyes are my best feature, and I'm losing that now because I'm, you know, they're drooping or they got the wrinkles. So our goal is to direct them. So I think when we do that, and I think you do it elegantly, people don't feel like, you know, we're selling them something. Because to my patients, I just want to educate them on what they should do that's best for them. Do you agree? Yeah.
Doctor, they want you to be the best version of you.
I agree. 100. And I love what Mary said. You know, you want your best version.
And you have to tell them, look, you really, you know, and listen, sometimes I don't sync with a patient because they're insistent, you know, that they want their lips done and they're so overfilled.
And what do you do then?
They look like a peanut head.
I don't touch those patients. And I know you don't either. So, because if I'm not in sync with the patient, if I don't like the patient, I'm not going to touch them. And many times I actually tell them, you don't need fuller lips, or you don't even need that. I mean, half the time, you know, I probably put in half the fillers or where they want it, because I don't think it looks good, because I'm not going to do anything unless it looks good. And I'm sure you do the same thing, Mary, right?
Exactly. You know, there's nothing more important than the canvas of the skin. And we talk about that all the time. And, you know, I know you want to talk about skincare, because it doesn't matter. You can put all the filler and do a great job with the Botox. But if the skin is brown and blotchy and dull, no one's going to appreciate it.
Right.
The first thing you see is the reflectivity of light off of the face, off of the cheekbones, off of the forehead, off of the chin.
Right.
And, you know, so you have to have clarity of the skin. And so in my practice, I use lasers and I use skincare to improve the quality of the skin and the light reflectivity that you get. Because as you know, part of the reason when we do a laser or a radio frequency microneedling device or an IPL device or the myriad of things we have in our office, that when we build collagen, it's really the collagen in the dermis that is causing the light reflectivity.
Right.
As long as you don't have that melanin disbursement at the dermal epidermal junction, blotching things up. So you need to clear out the excess irregular pigment.
So what I'm gonna summarize, because I think what Mary has said is so important, because that synergy is go to the best doctor, the best dermatologist, the best plastic surgeon. They will be upfront and honest with you about what you need and what you don't need. The worst thing you can do is go to somebody and say, "Oh, I want bigger lips," and they'll just do it. Or, because you want their advice, you want their expertise. You want someone that has an aesthetic eye, like Mary just talked about, that will make you your best self. And do it in a proper way without overinflating your lips or your tear troughs and make you look like somebody else. Because, as plastic surgeons and dermatologists, we're in the face protection, not witness protection program. And we don't like that look, right? And so I think, in closing, I think what Dr. Lupo has said is so important for our viewers, is because find a good doctor, find somebody that really cares about you. And you need to sync with them. You really need to relate to them, and find somebody that's going to be on your side to be your best self. What other closing thoughts do you have, Mary, that I think people should find when they're trying to find the best dermatologist, the best plastic surgeon?
Well, obviously you want to make sure that your dermatologist is board certified by the American Board of Dermatology, just as you want your plastic surgeon to be board certified by the American Board of Plastic and Reconstructive Surgery.
Right.
I think that is, what does that mean? Let me tell you what this means. And Rod, it means that first you've finished an accredited residency program that has been rigorously evaluated and certified. And then once you've finished, it allows you to sit for the certifying examination. And then when you pass that a certifying examination, you are board certified. Yes. So first you want someone who is at least trained, board certified. And then I think the second thing is everyone has their own, what I call aesthetic. And that is their taste, like artists.
Right.
The technical aspect of what we do, and then there's the artistic aspect of what we do.
Right.
If you walk in and the dermatologist looks weird, that's their aesthetic, and you don't want to go to that dermatologist unless you wish to look that way. And I will use weird as a relative term. I mean, maybe there are people that think I look weird, and if you've got big old giant lips and big cheekbones, that's normal. I don't, the point, you've got to go to someone who looks the way that you think a natural person
should look. Yeah.
And when I tell people all the time, and I joke with you, I go, look, and I show them, I go, no facelift yet. I do all of this with lasers and injections.
Yeah.
And I'm I believe in aging gracefully.
Yeah. And you've done a great job. And, we've all done that, the Botox, the neuromodulators, the lasers, the intense pulse light. These are all things. You're so right, because the last thing you want to go to is a dermatologist or plastic surgeon that looks weird, because guess what? That's their aesthetic. And so much of plastic surgery and dermatology is the artistic aspect of it. Less is more, giving you the best look for you and keeping your individual beauty, your signature one thing, whatever that is. So, Mary, thank you so much for those wise thoughts and words. And I can tell you, as someone that is looking for a great dermatologist or a great plastic surgeon, those are such wise words. Be board certified. Find someone that you can relate to, that's likable, that's not going to, sell you things that you don't need, and, just give you a better version of yourself. And aging is a continuous process. So, you can't just have it, it's not a one and done. It's a one and continuously ongoing to look great. So, Mary, thank you again so much. And tell our viewers how they can reach you and what your website is, so they can reach you if they want to come see you.
Dr. Mary Lupo, but the main thing, I'm much more active on Instagram than anything else, and it's at Lupo_dermatology.
That's right.
And I do answer direct messages. It's hard for me to give specific, relevant information for someone who's not a patient of mine, but I certainly can tell them who I know in their area, who I've either worked with and I know is reputable and talented. Because at the end of the day, you want someone who isn't going to humor you and do what you want unless it's the right thing to do.
I agree. Great wisdom. And I think it's good. You can DM her. I mean, or, you can DM me, but most importantly, you can just, I usually have my email and you can talk to my staff. So great. Mary, thank you so much. You rock. And prudent advice. Remember, if you want to be your best view, come join us on Rohrich Knose, and you're going to have an amazing guests like what we had today with Dr. Mary Lupo. Thank you so much, Mary.
Thank you, Rod.
You bet. All right.